We've all been in hands-on workshops and we are wanting to know, well, how hard do I apply that pressure? How deep do I go when I'm doing that particular manual therapy skill? This course will help objectify the answer for that question and has been developed for therapists that are looking at oncology manual therapy. My name is Denise Stewart. I'm an occupational therapist from Australia. Welcome to my clinic. I've spent my working career examining what other therapists are doing so that it can inform my practice, because I wanted best manual therapy practice, not only for my patient, but for my own health and well-being. So I was quite curious about what other therapists have done. And when I got to see that the difficulty in watching what people are doing and interpreting that, or if they gave me some words to describe whether they were using light or gentle or firm pressure, I felt that those words just didn't translate to what I do clearly enough for my brain. But the common feature that I saw across countries and across therapists was that therapists use a low tension manual therapy for people after cancer. So it's this low tension pressure that got me wondering, well, how do I convey this to my students, to other therapists? So there are 3 parts to this course, and it's only a short course. One is to know the history of using a pressure sensitive device or a pressure testing device. 2 is to create your own pressure sensitive testing device, and that's using items that you can purchase in and just put them together. And the 3rd part of the course is to practice 3 low tension compressions that I use in my breast cancer rehabilitation practice. So you'll learn to use the device to, 1, assess your current pressure or compression force, and then to use the device to train your treating hand to apply reliable low tension compression at 3 different levels. So 3 levels I'll be looking at are a compression rate for the skin, for the superficial tissues, and then for the deeper tissues. So if you're looking for a way of assessing and communicating the compression rate that you're using, and wanting to develop a low tension compression rate for oncology patients and for your own health, then join in and sign up for the course.